In the heart of Edo State, a remarkable institution stands as a testament to healthcare excellence, Stella Obasanjo Hospital. Founded in 2007 and born from a vision of progress.
Stella Obasanjo Hospital was an interesting project because it was solving a critical gap in the healthcare system, which is in delivering secondary and tertiary healthcare at global standards. So the standards we had set out for Stella Obasanjo Hospital were quite high. As you know, it was an existing hospital, mostly around mother and child, though they had some other specialties, but it was not operating at the level where we could call it a proper tertiary and referral hospital.
The Stella Obasanjo Hospital is a massive infrastructure project, and we wanted a situation where it becomes like the hub for healthcare in the region.
This hospital has grown from a community-focused healthcare center to one of Nigeria's leading medical facilities. Initially designed as a 200-bed facility focused on women's and children's health, addressing the essential needs of Edo's families.
His vision was, I want a hospital like I have seen in other parts of the world. I want to come into this premises and feel like someone has thought about my healthcare needs from end to end.
My aspiration is that Edo will be number one in healthcare, just like it is becoming number one in many other areas. In technology, in education, in agriculture, in land management, and so many other areas. Edo will be number one. And we will be number one in healthcare.
Then came the COVID-19 pandemic, a test for healthcare systems worldwide. Stella Obasanjo Hospital became a lifeline, transforming into a 300-bed isolation and treatment center. Partnering with state and federal bodies, the hospital offered life-saving care to thousands, exemplifying resilience and commitment.
The actual design for the hospital started during COVID. His Excellency, in his magnanimity, had decided that the team would be put together during COVID to start to design out what Stella Obasanjo would look like, the future of Stella Obasanjo.
It became very clear during COVID that there was a huge deficit in terms of healthcare provisioning for the states and the region. You see, during the pandemic, a lot of our healthcare system was challenged, and we really didn't provide the kind of response that we saw in many parts of the world. But it raised the fundamental issue that if we had a full brunt of the pandemic, how would we have responded?
Today, under the visionary leadership of Governor Godwin Obaseki, Stella Obasanjo Hospital has been reinvented. A state-of-the-art facility equipped with cutting-edge technology and specialized care centers now stands where the original hospital began. This transformed 250-bed facility boasts a medical gas plants, intensive care units, advanced diagnostic labs, and even a specialized fertility clinic.
Stella Obasanjo Hospital has the first hydrotherapy pool in the region. We have now the modular theaters. We created this modular theater that allows you, as cases get complicated, as your doctors get better, you can change the structure of the theater to deliver the kind of complicated surgeries you need to do. The governor in particular is very compassionate when it comes to children's care. The pediatric ICU is a standard ICU. In the region, we don't have any pediatric ICU that can handle 24 newborns or neonates at the same time. The investments we've done there is to ensure that at every point in time, we can take care of at least 24 babies in the ICU and deliver care with the kind of equipment that you'd find anywhere in the world that is serious about delivering quality care.
Through the Edo State Health Improvement Program, Edo HIP, the state government is strengthening healthcare at every level, with remodeled healthcare centers, trained medical professionals, and a focus on accessible, affordable care. Edo HIP has been pivotal in creating a resilient healthcare system.
The Edo Health Insurance Commission that has come on board to ensure that people have access to healthcare without having to bring out money from their pockets, because there are times when one gets sick, you may not even have money, and so that has been some really major innovation to bridge that gap of access to healthcare. And for Edo Health improvements, where it's about improving, increasing access to healthcare, and then having world-class facilities where Edo people can have access to healthcare.
People don't pay for healthcare out of pocket. They don't pay cash. They pay through some savings arrangement which is in place, particularly health insurance. So what we've done in Edo under HIP is to ensure that we think through how to get access to more people, think through how to improve the quality and affordability. Where does SOH come in? Comes in that middle issue, which is quality care.
We expect that in the coming years to come, doctors will be trained, churned out from this hospital that will help the state, the subnational, and also West Africa as a whole. We expect that this Stella Obasanjo Hospital will be a destination for transplant surgeries, immunologic therapies, those kind of therapies that you do not find in this region. And we hope that our collaboration with a public-private partnership and also with the health insurance scheme will bring sustainability to this place. So come here in 10 years' time, come here in 15 years' time. The structures and the systems that are supposed to make it work are already in place, and we hope that the Edo people appreciate it. We hope that the Edo people utilize it. We hope that the Edo people own it.
Today, the outcomes are tangible. Residents across Edo State benefit from specialist access, reliable emergency care, and initiatives like telemedicine that bring healthcare closer to remote communities. From 24-hour emergency response to sleep clinics, the state's approach transforms lives daily.
If you have a world-class institution like the Stella Obasanjo Hospital, which we've rebuilt, it therefore means that the community practice here will be so rich because you already have a teaching hospital and you have people who have experiences, have gathered experience from all over the world who are available to contribute to this institution. The unique location as a logistic hub between the western part of the country to the east, to the south, and the north means that there is a viable traffic of people who will come and seek care here. The way we have designed the hospital and invested in equipment in the hospital therefore means that with the experts, the available facilities, the infrastructure that's in place, we can provide very superior healthcare solutions. So the impact will be that rather than people traveling out to Lagos, Abuja to fly out for treatments abroad, they can come here to Edo to get the kind of cure they want to. So with the quality of infrastructure that we have put, with the thinking, the health care administration system that is in place, we will be raising the standard of care in Nigeria significantly. 230-bed hospital, well equipped. I don't think there are many of such, if any, in our sub-region. So the Stella Obasanjo Hospital will stand out as a center of medical excellence.
With each life saved and every patient treated, Stella Obasanjo Hospital and the healthcare reforms in Edo State represent a bold vision, a commitment to health, resilience, and a thriving community. Edo State continues to set a new standard where healthcare isn't just a service, but a pathway to a brighter future.